we've done a million segments about Ozempic. But I do think it's good to recap it every once in a while.
Yeah.
Because this drug is not going away. Like, I would even say that Ozempic is, I was thinking this when I was doing the segment, Ozempic's the biggest drug of the 20th century. I'm not sure there's a bigger one out there as far as like how popular it's become and how it's just consumed the media, both like in the medical aspect, in like the pop culture, health and fitness.
Yep.
I mean, everything. This thing just dominates. So we are doing the Ozempic 2026 update, new data, and also a pill form, which is huge. Now, I don't know if you guys have been here since we've done a big Ozempic recap, because Kalee being pretty new, Brenna also, have we talked about Ozempic?
We have.
I have, okay.
Yeah, like a couple times. The name is just so, I feel like it has such a big name, which is like great for on their end.
On their brand, right?
Yeah.
Because really it's not just Ozempic.
It's a whole bunch.
The proper term is GLP-1 agonist.
Yeah.
Which then covers...
That's not as trendy. It's not as...
And it's kind of
it's not as memorable,
yeah. It's kind of a mouthful,
Semi-glutide.
Yeah, it's not GLP-1 face. It's Ozempic face, right? Have you guys heard of that, right?
I have.
Yeah, okay. All right, very good. All right, so we've talked about this a lot. So there's around 40 million Americans that are using GLP-1s, which is huge. That's like 10 to 15% of the populace. Originally started as a diabetes medication, which I think most people know that. A lot of people don't know it's been out for 20 years, though. It's been out since the early 2000s, and they figured out sometime in the kind of early teens that, hey, these patients are losing weight when they're taking this diabetes drug. So then it started being used for weight loss, and then it absolutely exploded in the last 5 years, like bigger than any drug I can think of. I mean, the other one that comes to mind is maybe Viagra when that hit the scene, and it was like, oh, whoa, this drug's great. Yeah, everyone, give it to everyone. So how does it work? Well, it works by slowing down how your stomach empties, right? So you won't eat as much. And it also directly targets the receptors that tell your brain that you're full. There are receptors for that. So it works in a couple ways. There's also triple-acting ones out now, like tirzepatide, which work even better. And how effective are these? Well, for your basic Ozempic, semaglutide, GLP-1, like the average is around 15% weight loss, which is pretty good. That means, like, say somebody comes in weighing 200 pounds, they can easily expect to drop 30 pounds. That's huge.
Yeah,
that's good. That's really
My sister-in-law has a TikTok and she does this.
Oh, does she really?
Her whole TikTok is about GLP-1.
Really?
And she has, I can't remember the exact number, but she's lost, I mean, it's got to be close to like
so we actually
80 pounds or something. I mean, she's lost a ton of weight. It could be more than that. I might be speaking out of turn. I should just text her real quick. But it's pretty amazing.
Yeah, it's crazy. And we offer this through my office. And so we've now seen tons of patients that have been using this. And we have some that have lost up to like 80 pounds, I think, maybe 60 to 80.
I'm going to keep talking.
Keep talking. You can find out. So, we now have some great experience seeing these patients. And there are newer versions where people are losing even more weight. Some of the triple-acting ones, people are losing up to 22% of body weight. And that's on average. That's not like the max. That's on average. And the benefits go way beyond the weight loss. Now...
Oh, 78 pounds. I was really close.
You are close. That's really good. So the benefits go way beyond weight loss. Like there's the diabetes control aspect. The cardiovascular risk reduction, that is a real thing that people are less likely to have like heart attacks and strokes if they're using this medication. Blood pressure and lipid improvements, and then decrease in fatty liver disease. Now, these are the things that we already knew about. And each year when these studies would come out, because more and more people are taking this and they're studying this thing to death, like there are all of these new benefits that keep coming out. And the health benefits are enormous. Why? Well, when you're obese, you have all these health problems, and when you lose the weight, they go away. Yeah. So it all makes sense.
All of her labs from last year to this year she was in the yellows.
Yeah.
Like I don't know all the terminology, but they're all green now. Like all of them. And I'm not to cut you off, but I also was on tirzepatide from May of this past year to October because I've been pre-diabetic and I've had hypothyroidism. So
you probably were taking a lower dose because
very low. Mine was very low.
So at that low dose, did you notice any of the weight loss effects?
Oh, I lost 10 pounds in 4 weeks, which I didn't need to lose. But what else I lost, which I've had a struggle getting back, is my muscle. Like my body hurts all the time because I'm now having to build my muscle back up.
Right.
But that being said, I corrected my Hashimoto's, like my thyroid's fine.
Yeah.
And I also, because I learned how to eat on the shot, I know my blood sugar drops are almost non-existent. And I used to have blood sugar drops on a daily basis where I would get really crazy, hangry, start shaking, like feel really, really sick and about to pass out. Those are, and I'm not on it anymore. And
man, that's awesome.
You know, so I'm a pro for this.
Yeah. Well, and you bring up the flip side of the coin when you were talking about what was the? Oh, your muscle loss. Sorry, I knew you mentioned. Yeah, muscle.
That's been a bad one.
Yeah,
for me.
So that's like a known issue with GLP-1s, and it's not like the GLP-1 specifically. It's just that when you decrease your caloric intake, you're going to lose fat mostly, but you are going to lose muscle. But there's ways to offset it. Even like minor resistance training with weights like offsets those downsides. And so, and I do think that although I'm a massive fan of these drugs, and I say that completely from the aspect of the benefits, not because we have it in our office. Like we don't make jack on giving people Ozempic. I mean, do we make a tiny bit of money? Sure. But it's not like I believe in this because like, I'm getting rich hawking Ozempic. I'm not at all. It's just that, I want to be like completely transparent.
Yeah.
Like when you look at the positive data on these drugs, it's like overwhelming, but it is for people that need it, you know, and one of the downsides of Ozempic is there are now a lot of people that are taking it that really don't need it.
Yeah.
You know, they're like, they want to lose, they take it, you took it for a medical reason, but there's people out there like, well, I need to lose 8 pounds, I'm going to take Ozempic.
Yeah.
And I don't really like that. Also,
well, it's going to come back right. Like all my weight I lost came back, but it's fine.
Well,
I don't mind.
If you're using it for weight loss and you're going to someone like me, we help you through that.
Yeah.
I mean, but you were taking it for a different reason,
yes.
so you didn't get that added kind of informational aspect. But yeah, the other issue is that there's a tendency for the pendulum to swing too far. Ozempic face, that's real. I mean, people are losing so much weight that they're kind of getting an unhealthy look. And we talked about, I can't remember, there was some celebrity we talked about, just like, I think it was right before you came on the show, that I saw a picture and I was like, man, they don't look good. Because they were so skinny. Like they were just like almost looked malnourished. It was somebody really big too.
Well, correct me if I'm wrong. While you think,
yeah, I'm trying to remember who it was. I can see your face.
I've had a little bit of filler, just like a little bit. As you get older, your face I'm not going to give this because he knows what he's talking about. But you thin and you become a little bit more hollow, and so filler helps that. But Ozempic makes that go faster, right?
Yes, 100%.
Okay, so I'm correct in that statement.
Weight loss.
Look at me.
Weight loss in general makes you look older.
Yeah.
I mean, without question, that is definitely the not talked about downside. That when you lose weight and like your face hollows and your skin starts sagging, like, and not just your face, but like your breasts, your arms, your tummy, it makes you look older. Yeah. And there's also been a big noticeable rise in body contouring in the past few years. Why? Because people were losing weight. We talked about this the other day when we were talking about the men in plastic surgery. It's like I do tummy tucks on men now pretty commonly. You never saw that. And now you do because they're losing that weight. But I do want to talk about the new developments real quick because we are recapping for 2026. So an Ozempic pill was just released. Pretty big news. Now, a couple things. It's daily pill, all right? So it's not weekly like the shot. So you got to keep that in mind. It's not quite as effective as the shot, but it's pretty darn close. It's like, in the studies I looked at, around 90% is effective. So you're still getting a good amount of weight.
What about the side effects?
Basically the same from what I know, but it's brand new.
Yeah.
So you're looking at the very first study which kind of approved it.
Yeah.
But I think this is big because there's a lot of people out there that don't like to take injections. The injections are also a little bit more complicated. They have to be kept refrigerated. So there's like an extra layer of complexity to it versus a pill where it's just like, oh, I take the pill in the morning. Like this is going to be a big deal. Like the fact that they've got a pill form of this is pretty big. Other developments, they're still talking about the risk of pancreatitis. That is a very, very small risk with the use of GLP-1s. My opinion, it's related to the fact that if you take a lot of a GLP-1, it's going to affect the way that your bile flows through your common bile duct, which then goes into your pancreas, which if that gets clogged up, you can get pancreatitis. To me, it all makes sense. I think it's probably higher risk if you're taking extreme doses or you don't have like a doctor helping you, in your journey. The other thing, there's the question of there's an association with optic neuropathy. This is kind of a new thing. The data is still kind of coming out on that. It's not like a smoking gun or anything. It's just like, oh, we need to look in this to see if there's a link.
What does that mean?
Optic neuropathy, basically you can get issues with your vision due to inflammation of the optic nerve.
Oh, okay.
So that's kind of a big deal if it happens. But it's not it's not like suddenly there's been, hundreds of patients. Yeah. It's like there's some cases of optic neuropathy that they notice people are using GLP-1s and they're trying to figure out if
what the connection is.
Yeah, and there may not be one.
Yeah.
But they're trying to figure that out. They have decided there's no link with suicidal ideation, which was something that was talked about in the past year. It was looked at and studied. It's like, okay, that's not an issue.
What about the blood pressure medicine? Wasn't there like a connection with that, or am I making that up?
Well, GLP-1s decrease your blood pressure. It's not a blood pressure medication, but the weight loss always decreases your blood pressure. Okay, yeah, it must be something else I'm thinking of. So what's the future for GLP-1 in 2026? I think it's going to be the pill wars. Every company is going to come out with a pill. They're going to get better and better. So you're going to see that a lot. I do think it's being overused. I mean, people, even at the Grammys, like this past week, people were like, oh, this is just like an Ozempic fest because, so many people had lost so much weight and like, even if they weren't taking Ozempic, the internet's like, everyone's taking Ozempic, everyone's taking Ozempic. I personally would like to see it be reeled in a bit. I do have concerns with people that want to lose 5 pounds taking Ozempic. I have concerns about people who go too far and get malnourished looking from taking Ozempic. Yeah. I mean, there is such a thing of, too much of a good thing.
Yeah.
So, but some interesting news. I think we did in last January or February a Ozempic 2025, and we have some new data now. It's kind of interesting.
That's cool.
Yeah.